Yes.
This is Ifoma Obadike, and I'm a student, family nurse practitioner student, and I'm going to do your head, neck, ear, and throat assessment today. Is that okay if I record you, because my instructor would like to watch this in the YouTube as I'm listening?
Yes, it is.
Thank you for that consent. I am going to start your assessment by washing my hands with either water and soap or alcohol base, and then I will go into your hair. The first thing we do when we do this is to inspect the hair. I am inspecting the hair for any for symmetry. I'm inspecting for hematoma. I'm inspecting for any contour or any lesion or rashes. At this point, I'm going to palpate your hair. Is that okay for me to touch your hair? Okay, so at this point, I'm going to palpate your hair, and I'm palpating it for any contour. I'm looking for any depression. I'm looking for any hematoma, any mole, any rashes, any alopecia, which is hair loss, and usually in men, it usually starts in the middle of the hair. Well, I'm also looking to see if there is any lice, any rash or anything, which there is none. It's nice and clean. At this time, the next thing I'm going to do is to go to your face. I am looking at your face for any involuntary facial movement, any excessive hair. I am looking for symmetry, and which I don't see any of this in your face. The hair is even. This is a male, so it's even for a guy to have facial hair at some point. So he's fine. So what I'm going to do next is that I'm going to check the eye. So before I go into the eye, I am going to check the temporal pulses on the face. I am going to check the temporal artery. I am going to palpate the temporal mandibular joint, which is here. I'm going to ask the patient to open his mouth and close, or say ah. So his facial nerve is intact, which is called the 7th cranial nerve. It's intact because as he moved, he was able to open his mouth and close without any pain. So the next thing I am going to be doing at this point is to inspect the eyes. So I am going to inspect the eye for any redness, any jaundice, any form of discharge. I am going to pull the lower eyelids and look down. The eyelids is supposed to be pinkish, and then the eye is going to be wide and clear, which his is. There is no discharge at this point. I also inspect the eyebrow, and it's even, so it's symmetrical. There is no unevenness around it. So I am going to go on now to the next test, which is called the Senna test. So I am going to use this and stand. It's going to be 6 feet, and close one of the patient eye and ask him to read, and then close the other eyes and ask him to read with it. So if patient is using glasses, it's okay for him to use his glasses to read it. So he's going to read with the right eye, and then cover again, and then he read with the left eye. Then after that, you ask him to read with both eyes. And if patient is able to read everything down here, we say is 20/20. His vision is 20/20. So after that, so I have already inspected for ptosis and everything, cornea, the eye discharge and jaundice and all that. So the next I'm going to do concerning the patient eye is that I'm going to check his reaction to light. So I am going to use my pen at this point. I am going to come with the light from this angle and shine it on this eye, and then you see it react. I'll do the same to this other eye. It reacts on both eyes. because of the vision. So I'm going to also check your peripheral vision. So when I'm going to raise this finger, when you see this finger, tell me now, okay? I'm going to come with that.
No.
So his peripheral vision is intact. That's why he was able to see that. The next I'm going to do is that I'm going to check your oculomotor, truncal, and the Anderson. So the oculomotor is cranial nerve number 3, the truncal is cranial nerve number 4, and then Anderson cranial nerve number 6. So right now what I'm going to do is that I am going to raise my hands up, and I want you to follow while you're looking straight. I want you to follow my finger with your eyes and not moving your head. Yeah, you see, patient is able to move his eyes without moving his head for me. So I am going to use my ophthalmoscope to look into the patient eye. This time I am looking for the cornea and the red reflex. So let's turn this on. I'm going to okay, so when using this, we want to be right eye to right eye. You don't want to be bumping into the patient's eye. So this is my right eye, and this is the patient's right eye, right? So this is your right eye, this is my right eye. So it's going to be right eye to right eye, and then left eye to left eye, because I don't want to use left eyes to right eye, because it will cause an awkward moment. I don't want to be bumping my nose to the patient's nose. So at this point, what I'm going to do is that I'm going to get the patient's head, and I'm going to be looking. Yeah, I see that red reflex, and then I'm going to do this again with this eye. Yeah, so, and see that red reflex. So the idea is for you to be able to use it in such a way that you don't have to bump into the patient. So patient has right pupil, so I would say that his pupil is round, equal, and reactive to light and accommodation. So at this point, I am going to go down to the next test, which is his nose. So the first thing I will do, like we always start with, is inspection. I'm inspecting the nose for any redness, for symmetry. I'm inspecting if there is anything, any discharge, which there is none, I can find at this point. So I am going to change this up and put in my otoscope at this time. With this, and then put a new one in. So now I have this. So I have this all intact. I'm going to turn it off now, and first of all check for the sinus. I'm going to check for the frontal sinus by palpating this, asking patient, do you have any tender, any pain as I palpate it?
No.
Okay, then I will also go down to the maxillary and palpate, and asking patient, do you have any tender as I palpate here?
No.
No. Okay, so then it is now time for me to look into the nostril, and I am looking into the nostril. I want to also check if there is any blockage, so if there is any blockage or anything. So I'm going to ask patient to lift his into the spectrum. Oh, I'm going to turn this on. Yeah, it's supposed to be on. So everything it looks clear. Then looking for the spectrum or spectrum deviation. So, and everything seems to be clear at this time. And after I finish all that, the next thing I want to do is to ask you, can you breathe with one nose?
Yes.
Can you breathe with that?
Yes.
And I also want to check my patient and see if he can smell. So I have a cup here, and he has not seen this. I'm going to ask him to close your eyes. Yeah, I'm glad he's already closing his eyes for me. So can you smell this?
Yes.
What is that?
Coffee.
Are you sure? I'm going to close one nose. Can you smell this?
Yes, coffee.
I'm going to close this nose again. Can you smell this?
Yes, coffee.
Okay. Are you sure you're smelling coffee? Then smell again.
Yes, breakfast blend.
Okay, it's coffee. Yeah, I have coffee in this. So that's his sense of smell. That is his olfactory nerve, which is cranial nerve number 1. It's working very well. So he was able to smell what was in the cup. So the next, thank you very much. So the next test that I will be doing is the ear. The ear test, the hearing test. I'm going to be whispering one word to you, and then I would like you to say what it is. Then I also have to do the Waiver test and the Rena test for you. So I'm going to occlude one ear and
Apple.
no, hold on one second. I'll do it all over again. So I'll occlude the wrong ear. Okay, so
Apple. Baseball.
okay. So you occlude the ear and want the patient to hear. So he passed his whisper test. So the next one that I have in place is going to be the Waiver test. In Waiver test, I hit this and I place it here. The patient should be able to hear it on both ears. Can you hear it?
Yes.
Okay, so patient is able to hear it on both here, and I'm going to do the other one, which is called the Rena test. The Rena test, I'm going to put it on the temporal, and the patient should be able to hear it. When it stops, patient should be able to hear it. I will put it in his ear. You should be able to still hear it in his ear. Okay, so I'm going to try this with him. Can you hear it?
It stopped.
Okay, so now,
I can hear it.
okay, great. So patient is able to hear it. So that we say that the air conduction is greater than the bone conduction, which is good, and that's AC is greater than BC. So which is what we want it to be. And at this point, I am going to also look into his ear using the optoscope. So I'm going to change this one that I use for the ear, and I'm going to use the another one for his the one I use for his nose. I'm going to change it and use another one for his ear. So at this point, this is not getting tight. So is it not getting tight? So okay, good. So when you are using this, the most important thing is the safety of the patient. So when you're using this way, you want to use it in such a way that your hands are holding it in such a way that if somebody is coming over and bump into you, you don't want it to get into the patient's ear canal. So this is an adult, so we're going to pull his ear up and back and down. So I am holding it this way, I am looking into his ear, holding it with a safety measure, so that way if anybody comes in and bump into me, and I should be able to pull away without hitting my patient. So my hand is here there as a barrier to hold it in the patient. So I'm going to do also the same in there, and I can see the cone on the other one. So pull back and up there is no obstruction, and I was able to see the cone of light and the landmark of the whole thing. So here, this is all set. And the next other test that I have at this point is going to be the mouth. So I am going to be inspecting as usual, as we do. First inspecting the mouth for any dryness, symmetry, and all that. I'm going to ask you, sir, to open your mouth for me. So the tongue, I'm inspecting it, is beefy red, it's symmetry, there is no anything. I am also inspecting, at this point I will need my torchlight to look in. I am inspecting the tonsil is not swollen. I'm inspecting the uvula, I'm inspecting the dentation. It has a nice dentation, there is no decay or anything. I'm inspecting underneath the tongue, and it's nice and clear. There is nothing. And the mucosa, I may have to put on my gloves to palpate that and ask patient if he's feeling any of those pain or anything. So the next test that I will be performing on this gentleman is the neck area. And at this point, I am looking for symmetry. I'm looking for any rashes, any discoloration of any kind, which I don't see any. It's good, and his trachea is midline, in the midline. So at this point, I am going to palpate his trachea, and I want to give him something to drink. So I'm going to give you this cup of water, sir. So as I palpate you, so I would like you to drink some water for me. Swallow. Good. So as he swallows it, I can feel the movement from, I can feel the movement up there, and any of the lumps that we see that it's non-tender should be non-tender, and if it's not non-tender, like if it's tender and unmovable, it's something to worry about. But if it's movable and non-tender, it's nothing to worry about. That it's considered okay. So I will palpate and looking for any lump, lymph, or anything. So usually I will now go here and start with the pre-ocular and go to the posterior ocular, and this is the occipital, and I will move down to the tonsil, and then this is the tonsillar, and then I will go to the clavicle. This is the clavicle, and then I will go to the submental, and then I will go to the sorry, I said it wrong a little bit ago. The subclavicle is here. We go to the subclavicle, and then we go to the submental, and then we go to the superclavicle, and we go to the posterior clavicle and the anterior clavicle of the patient. We are palpating for any lymph node as we are going to these points. So, and in this patient, we do not have any lymph node of any kind in it. So that brings me to the end of this HEENT test today, examination. So thank you for coming in today. Do you have any question?
No, I don't.
All right, thank you very much.